Hey everybody, Dr. Skip Weiss here. So I want to address the elephant in the room with the new acetaminophen announcement that was made yesterday. Its possible ties to autism, how it affects the glutathione production in the mom and the baby. And you're going to see these things posted all over Facebook. And nobody's going to really talk about the elephant in the room, which I can't believe nobody's talking about this. And it has nothing to do with autism. It has nothing to do with neurodevelopment of children. It actually has nothing to do with neurodevelopment of the mom either, besides the fact that nobody, absolutely zero of you, are talking about the chronic pain epidemic that we're seeing in pregnancy over the last 20 years. And moms have been given basically one option to help them with their pain when they're pregnant, and that is acetaminophen or Tylenol. And the problem with that is that is not the only thing that can be done to help out our mothers. Typically during pregnancy, the top two most most common complaints during pregnancy is sciatica and headaches. Headaches in the first trimester, which can be completely debilitating, and sciatica starting right around 15 to 20 weeks, going all the way through their pregnancy and their delivery. And these things are debilitating. Working in the field of pregnancy for over 18 years in chiropractic, I can tell you I have seen moms come in with crutches, with walkers. I have seen pregnant moms crawl in. I have seen them brought in holding on to their spouse, crying because they're in chronic debilitating low back pain, chronic sciatica, pubic bone pain, which can be absolutely horrible, and of course, with migraines, typically in the first trimester. And the only thing that they're told is that they can use some form of non-steroidal anti-inflammatory, particularly acetaminophen, because they're told that's the safest thing according to ACOG. But I will tell you that it still has side effects. These things still have side effects. So we need to look at this from a different standpoint of why is there so much pain in pregnancy? Why is there headaches? Why is there sciatica? Why is there debilitating low back pain? Nobody's actually talking about this, is why are moms having to take this stuff in the first place? Why are moms not able to sleep at night? I have had probably 50 moms in the last 10 years tell me that they take Tylenol PM when they're pregnant so they can sleep at night. Taking it every night to fall asleep because they have low back pain, they can't get comfortable, they have uncontrollable acid reflux. Whatever the symptom is, they're taking this to try to get rid of pain. But why is it happening in the first place? Why are our moms not given other alternatives besides a medication? Why are they all of a sudden spiking a fever in their pregnancy that needs to be treated with medication? There's other things being put in that is affecting this, and it's not okay. You see, therapists, chiropractors, people that deal with neurology on a daily basis that actually offer different solutions for our moms, we're the ones that are seeing amazing results with this. We can't just go and throw another pill at something that actually can be helped through chiropractic care, that can be helped through massage therapy, that can be helped through physical therapy. There's other things, there's other alternatives, there's other homeopathic things out there as well that can help with pain management, that can help with, if you have to, manage a fever. But why are our moms not given these options? Why are they told by their healthcare provider that the only thing available is acetaminophen? Why? When chiropractic's extremely effective at getting the body back to regulating itself, getting the mechanics back to help moms sustain an amazing pregnancy and get them so they don't have pain anymore. As a chiropractor that works with pregnancy, that's certified in Webster's Care, I'm not trying to get a mom out of pain. I'm trying to restore neurological balance. And when I start restoring neurological balance through very specific and precise chiropractic care, detecting and eliminating vertebral subluxation, which is interfering with how their body can heal, then we start seeing amazing results. And we start seeing pain go away. We start seeing headaches go away. We start seeing normal states of pregnancy come back to mom because we've restored normal to the body. But why aren't moms told about this? Why is it okay that we can just say, you know what, you got pain, so for the next 30 weeks, just take this XYZ over-the-counter non-steroidal anti-inflammatory? Yes, there are correlations being made, and some people get really upset and they're like, trust the science. Well, new science is coming out every week, every year. So why aren't we reading that and kind of holding space for that to understand it? Because I would want to know if something's changed in my field that could radically change the way a mom's health is. And why are we so upset that something to avoid or possibly take into consideration as a warning to make a mom actually second think about, maybe ask a question, maybe I shouldn't take this. Maybe I should go this route. Or maybe ask a question as far as just, is this okay to take? And what are the side effects? Ask them. Ask them. Open up the bottle, look at the label inside, read the side effects, because they're there. Chiropractic, side effect of chiropractic, we can be a little uncomfortable after an adjustment. It's very possible, okay? We could get dehydrated. We need to hydrate, get more water. Like, these are things that we need to put into our systems, but also be very aware of at the time. But it's okay to ask questions. And if we start seeing correlations, should we not hold value to that? But the biggest question, like I said, is why is there chronic pain? Inflammation, diet, toxins coming into the system, chronic stress, moms being told basically that they're on a 40-week timeline to have this baby and put under tremendous amounts of stress with lots of ultrasounds and different check-ins and all these appointments when birth is supposed to be tremendously valuable, amazing, and a beautiful experience for both mom and child, but really what it's looked at as a 40-week parasite. That's not okay with me, and it shouldn't be okay with any of the moms. And we have to be able to give alternatives to help our moms get out of chronic pain. That's what's not being talked about. Is why is this a problem in the first place? Why is it being taken in the first place? Start there. Let's provide proper solutions and then start having these moms having super healthy pregnancies. Share this to people to actually get a different perspective. I'm not bashing either side. I'm not going on any other side. I'm talking about what's blatantly obvious in your face right now and nobody's talking about is why is there chronic pain going on in the first place, and how do we properly address that to get the body back to healing itself and get these moms the best pregnancy possible with the least amount of intervention that we can possibly do. I'm Dr. Skip for Prime Family Chiropractic Centers. We're the official sponsors of happy and healthy pregnancies here in Northeast Wisconsin. So if you know anybody that needs our care, reach out to us. Moms, if you're in chronic pain, if you have headaches, if you have low back pain, sciatica, constipation, heartburn, indigestion, all of these things that come with being pregnant when we're dysfunctioning and not communicating like we're supposed to, reach out to us. We'll help you find a Webster certified chiropractor in your area, or we're here for you to service whoever wants to drive and see us. Have a great day, you guys. Have a wonderful week. Bye, everyone.